Have you ever felt overwhelmed by your work in helping others? In Zambia, humanitarian workers face unique stresses that can lead to vicarious trauma, compassion fatigue, and burnout. Today, we're exploring these challenges and prevention strategies tailored specifically for Zambian humanitarian contexts. Humanitarian workers in Zambia deal with personal hardships while supporting others. Frequent staff turnover in NGOs disrupts teamwork, while inadequate funding for self-care increases stress. Many workers also have personal connections to the very issues they tackle. This blurs professional and personal boundaries. Cultural expectations in Zambia create additional challenges. There's a strong belief in resilience, particularly among men, which can make seeking help difficult. Spiritual beliefs about suffering may conflict with evidence-based psychological approaches, adding to stress instead of alleviating it. Plus, Zambia's diversity of languages can complicate critical conversations around mental health. To understand the risk factors, we must consider the numerous pressures workers face. They manage personal safety in remote areas and contend with economic family obligations. Systemic challenges limit their effectiveness. This accumulation of stress often results in compassion fatigue and burnout without proper recovery methods. So, how can we prevent these issues? Effective prevention must adopt a multi-pronged approach. We start at the individual level. Regular self-assessment can help workers identify distress early. Tools like the Professional Quality of Life Scale have been adapted for similar African contexts and could be applied in Zambia. On the organizational front, it's essential to manage workloads realistically. Clear job roles and proper staffing levels are crucial. Staff should not feel overwhelmed by administrative burdens or vague expectations about work hours. Transparency in workload is particularly important during seasonal challenges like flooding. Let's break down prevention strategies by setting. In urban humanitarian offices, regular team well-being check-ins can offer much-needed support. For rural field sites, creating rotation systems and ensuring communication can significantly help. In refugee settlements, engaging with traditional healers could facilitate wellness. Tailoring interventions to these unique contexts is vital for success. Systemic strategies require advocacy for improved care standards. The Zambia Humanitarian Response Network could adopt minimum staff care standards. Collaborating with the Ministry of Health could take us a step forward in recognizing vicarious trauma as a legitimate concern for workers. When prevention alone isn't enough, timely interventions are crucial. This means ensuring that support systems are accessible and culturally relevant. Peer support programs can be effective when properly structured and supported. They harness existing community traditions while addressing workplace stress. Should a worker's distress become more significant, counseling may become necessary. Many cities have limited resources, but creating referral networks with local mental health professionals could enhance service access. Telecounseling is evolving and can help remote workers, although tech constraints should be tackled. Consider integrating traditional healing approaches too. When ethically done, they can resonate well with Zambian workers. Some research supports traditional methods like cleansing rituals for processing trauma, particularly when paired with psychological efforts. In summary, Zambian humanitarian workers face unique challenges that require targeted prevention and intervention strategies. By recognizing the cultural context and the specific stresses, we can promote healthier work environments. Vulnerable professionals need to feel supported and have resources that resonate with their experiences. If you found this topic helpful, subscribe for more insights. Share this video with someone who might benefit. Let's work together to support our humanitarian heroes in Zambia.